Are we all set?
You may now begin your meeting.
Thank you. I'd like to call the Health and Human Services Committee meeting to order. Madam Clerk, please call the roll.
Alderwoman Green.
Present.
Alderman Gunther.
Here.
Alderwoman Martin. Alderwoman Middlebrook.
Present.
Alderwoman Rice.
Present.
Alderman Todd.
Present.
Chairwoman Negracia.
Present.
6 present, you have quorum.
Thank you. The first item we have up is approval of the minutes from the June 9th, 2021 meeting. If you've had a chance to review those, would entertain a motion to approve those.
Make a motion to approve the minutes from June 29th.
Second.
Second.
Please call the roll.
Alderwoman Green.
Aye.
Alderman Gunther.
Aye.
Alderwoman Martin. Alderwoman Middlebrook.
Aye.
Alderwoman Rice.
Aye.
Alderman Todd.
Aye.
Chairwoman Negracia.
Thank you.
I'm sorry, you said aye, right?
Yes,
Thank
thanks.
you. 6 aye votes.
All right, the first item we have on the agenda is a conversation with the Board of Health and Hospitals regarding some community engagement efforts they're undertaking. I'm not sure who wants to go first, but you are more than welcome to start.
Hi, Alderwoman, this is Rhonda Ballou. I'm the chair of the board, and thank you for inviting us and for giving us some time at your meeting today. We just wanted to make sure that we are in communication with you about some community engagement activities that the health department is working on, and would like to engage your constituents and make sure that the Alder board is aware and can help us out, and that we can partner on these efforts. And so we have Dr. Eccles on the call, and Kimberly Vandenberg and Harold Bailey, who work in communications in the health department, and Lisa Richter, who's another board member, and she is the chair of the communications committee. So I will hand it over to, I guess, Harold, are you going to start it out, or Dr. Eccles?
I'll start it out and then I'll.
Thank you, Dr. Eccles. Good morning.
Good morning. Good morning to the Health and Human Services Committee. Thank you all for your time this morning. One of the goals of the City of St. Louis Department of Health has been to engage our constituents across the city and involve them in some of the decision-making related to health and educational materials that we put out into the community. So one opportunity that we established was for the laypersons in the community to really let us know what they feel the most important public health issues are. So we would build a community engagement, community communication plan around priorities that the community establishes. So what we did was we wanted to make sure we created a platform where they could submit their information to us. So one way that we did that was through the development of a survey. If I can share my screen. You can let me know when you can see my screen. So the health department, we wanted to make sure we were implementing an evidence-informed approach. And so we worked with our epidemiology team. We also worked with external stakeholders to develop this survey, which was launched yesterday. So we initiated the communication with the community regarding the survey on yesterday through our social media platforms. And what it does is ask the community a series of questions about what they think the priorities are, but we wanted to make sure that we're also able to tie back their responses to their zip code so we could see how priorities across different zip codes may vary. And so we asked individuals for their zip codes, and we also have about 9 questions, but initially we listed different wellness areas that have been established by the health department, which includes emergency preparedness, food safety, gun violence, mental plus behavioral health, nutrition and active living, and sexually transmitted infections, including HIV and AIDS. And so Individuals will select yes or no for the topics that are available, and then the next question is asking if they're familiar with any of the phrase "be well" that's been associated with the Department of Health's information that we've been releasing over the course of the pandemic. The next question kind of asks them about a slogan. So we're also looking to establish a slogan that can be attached to different health priorities. So whether it's animal care and control, or if it's mental and behavioral health or substance use disorder, we want to make sure that there's one phrase that's selected by the community that can really tie all of our programs, our communications together. Then the next question, again, asks them to rank or select two choices based on the list that's available. And then we also ask them to rank the choices that are most important for their neighborhood. And then if there's any other areas of wellness that aren't included, we want them to provide information that in this free text area as well. The next set of questions goes through, which are optional, is demographic information. We know that sometimes individuals may not feel comfortable providing their race and ethnicity or their age and so forth. And so we didn't want that to be a barrier. We want as many people as possible to contribute to the results of this survey, because we want it to truly be an community-informed project, because we value the input of our stakeholders, which are laypersons in our community, as we move forward with the development and implementation of public health initiatives. And so our ask for you all is, one, we want you all to be familiar with it, as Dr. Ballou said, but we also would love for the Board of Aldermen to champion this as well, because as we learned over the course of the COVID-19 pandemic, public health impacts everyone and everything. And so we want as many people as possible to really complete the survey so that we can make sure that the communication that is established as a result of this really truly reflects the needs of the community.
Dr. Eccles, did you want anyone else from the health department or the board to speak before we open it up for questions?
Harold and Kim, if you have anything to add, feel free to add something now.
Yeah, I don't have anything else to add. I'm ready for questions.
Then just one quick thing, I'm going to share my screen again. Sorry about that. And so if you can see my screen, you can just nod. Okay. So this is the infographic that was developed, and if you follow the city's the City of St. Louis Department of Health social media accounts, you'll see this infographic that will be shared regularly over the upcoming weeks to make sure that we remind individuals about completing the survey. And we wanted to make sure we were also engaging the youth as well. So there's a QR code that individuals can scan with their phone and complete the survey using their phone. They can also go to the city's website and complete the survey online as well. And to reach individuals who may not be tech savvy, and those individuals who may not have the IT resources, we'll also be making sure the survey is available when we have COVID-19 vaccination clinics and other community events, so they can complete the form in person if they desire to.
Great, thank you so much. We'll run through the committee to see if anybody has questions. Alderwoman Green.
No questions at this time. Thanks for coming today.
Alderman Gunther.
Thank you. Dr. Eccles, I think you just said that, so that survey is online at the city's page, but then that flyer, are you guys printing those flyers so that we can put them up in senior homes and facilities that people might be able to scan the QR code, like restaurants and stuff like that? Do you guys have those flyers available?
We just launched yesterday, so we're in the we'll take that idea and also make sure we reach out to the living facilities, congregate living facilities in the city, as well as the academic institutions as well.
Okay, thank you. That was all.
Thank you.
Alderwoman Middlebrook.
Thank you. I have no questions.
Alderwoman Rice.
My only, excuse me, my only question would be if we could get the flyer to post online in a JPEG or a format that we can post up on our social medias. That is incredibly helpful when things come through that direction. So I know we've been working on that shift, and it's been helpful as those have come through. So thank you.
Alderman Todd.
I don't have any questions. Thank you.
Could you repeat that? I apologize. I didn't hear you.
I don't have any questions. Thank you.
You're welcome. Alderman Vaccaro, do you have any questions?
No, thank you for asking. No, but no, I'm fine.
Absolutely. Well, thanks so much to all of you for coming here. I don't know if any of you have had the opportunity to hop on any of the joint Health and Hospitals board meetings. I think they're the third Thursday at 8 a.m. I've been trying to attend as many as I can, and there's a lot happening. And so I appreciate the outreach to this committee. We're always receptive to having you come to speak to us. And I know I'm committed to getting the word out in the 6th Ward. But just one quick question. Do you have a goal, like a certain number of surveys that you're looking to get in to make it sort of statistically significant in terms of coming up with priorities and a plan?
Ideally, we would at least receive input from at least 20% of the city's population.
Okay.
I have one additional comment. Thank you for announcing and reminding all of the alders on this committee that we do have currently monthly board meetings, and our board meeting is this coming Thursday at 8 a.m. if you would like to attend. And second, after the survey is administered, you can't really tell everything that's needed from by a community, or really fully the community's thoughts and preferences and how to best serve the community from a survey. So at some point, we would like to do some community discussions to kind of really explore the responses to the survey, to see, dig a little deeper to see what the community's needs are and how the health department can best serve the community. So we hope that you would be able to help us in that way after we get the survey results, to kind of dig a little bit deeper, to explore really the meaning behind those survey results. Depending on, where we are with COVID, they could be online Zoom surveys with your constituents, or they can be outside, or whatever is safe. But we would like to do that after the survey.
That's great. I think most of us have lists of our neighborhood and ward meetings and then other places where it might make sense to reach out to constituents who aren't typically engaged in that way. So keep us posted on that.
Thank you. And please attend the meeting on Thursday.
Okay. Yeah, thanks everybody for being here. Dr. Eccles is going to be up next with an update on COVID-19 pursuant to the mask mandate extension that we passed at the board a few weeks ago. You can go ahead whenever you're ready, Dr. Eccles.
All right, I'm going to share my screen again. All right, when you can see my screen, please let me know. Yes, okay. All right, so this each week, the health department, we develop a COVID-19 weekly update. This one is a little different from the ones that we typically produce for our stakeholders, including elected officials and community-based organizations. We'll be including some state level data in this report. So the goal here is just to make sure that you all have an understanding of what we're seeing in our community and how your particular area of the city of St. Louis is being impacted by the spread of SARS-CoV-2. We'll start with the Missouri level data. There's several variants of concern that are being monitored by the Centers for Disease Control within the U.S., and there's also other variants of concern that are being monitored by the World Health Organization and other public health organizations across the world. But of concern, particularly in the state of Missouri, is the Delta variant, which was first detected in this state in the month of July, and at that time it accounted for roughly about 60 to 70% of COVID-19 cases that are being reported. And at this point in time, the Delta variant is accounting for over 96% of all COVID-19 cases. I think everyone here is maybe familiar with the impact that this had, not only on the urban areas, but also the rural areas, particularly those in north central and southwestern parts of the state. Overall in the state of Missouri, over 650,000 cases of COVID-19 PCR confirmed cases have been reported. And over the last 7 days, a little over 10,000 cases have been reported in the state of Missouri. And as you can see, based on this, this diagram here, it seems like we've plateaued with the onset of new cases. But however, there's a huge concern there because we're plateauing at a level that it is higher than what we need to be, especially as we look at the impact of the surge that occurred during the fall and winter months of 2020. If we have another surge starting off where we currently are, we could potentially be in a much worse position than we were in last fall and winter. And overall, the deaths have fallen off quite a bit. However, we do know that sometimes the death rate can lag behind any surge that we're seeing in the state. For overall vaccinations in the state of Missouri, so 5.9 million individuals have 5.9 million doses have been administered in the state of Missouri. For first and second doses, 5.8, almost 5.9 million doses for first and second doses. And overall, the percent of the state of Missouri's eligible population that have initiated the vaccination process is 52.7%, almost 53%. And those who have completed the vaccination process is 46.4%. So there's still a ways to go across the state as it relates to vaccine uptake. And that the lack of confidence in vaccines and other issues that are causing vaccine hesitancy continue to impact the state's and local public health organizations' ability to increase vaccination rates. Hospitalization data, this is statewide data as well. So as we can see based on the diagrams here, the number of hospitalizations related to COVID-19 seem to be going down, and that's likely due to the ongoing efforts to increase vaccination rates across the state. But again, we're still higher than we want to be. Overall, based on the data that's published by the state, 1,871 COVID-19 hospitalizations related to COVID-19 are currently in place, and then there are roughly the remaining total hospital bed capacity is roughly 29%, and the remaining inpatient bed capacity is 19%. So again, this is very, looking at where we were last year and the likelihood that we'll have increases in COVID-19 cases, as well as cases of other respiratory illnesses and situations that require hospitalizations, we could be in a much worse state come the fall if more people don't get vaccinated and we see another surge of COVID-19. Then I want to talk a little about city-specific data. So overall, this is a map that's produced by the New York Times looking at nationwide hotspots. So overall, you can see the city of St. Louis and the St. Louis region, overall, we're faring off a little bit better than surrounding areas, but we all know that this is a very fluid pandemic, and so we don't have, it's not wise to really let your foot off the gas at this point in time, especially as we head into the fall and winter months. 7-day average metric for the city of St. Louis. So right now we're not meeting any of our metrics. So the average for new confirmed cases is 44, new hospitalizations 75, total hospitalized among the pandemic task force hospitals is 516, and our average positivity rate is 9.2%, was rounded to 9%, which means that roughly 1 out of 10, 1 out of 11 individuals who receive a COVID-19 test has been receiving a positive result. So the national standard or the national threshold is 5%, which is really the threshold for opening up and keeping things open. So we're almost double that. So there's still a lot of work to do amongst our community to get the positivity rate down. And we know that the way we do that is by implementing the mitigation measures that we've been talking about over the course of the pandemic. Again, this is just the percent positivity, so it's again 9.2%, and the change from the previous week is negative 0.5%. So the totals for the city of St. Louis, so this goes back to the very beginning of the pandemic. So for confirmed cases on the city of St. Louis, we have 26,376 that have been reported. Then there have been 576 COVID-19 associated deaths. Of concern is, again, the Bush populations have been disproportionately impacted. We know that African Americans, at least since the month of April of this year, have accounted for at least 70% of all newly reported COVID-19 cases. And that population also accounts for 60% of COVID-19 associated deaths. This positivity rate you see is an average over the course of the pandemic. The 9.2% is actually the most current positivity rate for the city of St. Louis. And testing is really important. So we've 378,000 COVID-19 tests have been performed in the city of St. Louis, and that will remain a critical component of our response as we move through the next phases of the COVID-19 pandemic. And then next, we're going to look at some more specific city-specific data, particularly how the COVID-19 disease and SARS-CoV-2 is impacting specific communities in the city. So this is a rate map that we include in all of our weekly reports. So on the left-hand side, it has the raw data. So it shows the number of cases that are reported by each zip code. So as you can see, the highest number of cases that are being reported is from the southern part of the city, and zip code 63116, 63111, and 63118. But of most importance is we look at the burden of disease. And so in order to look at the burden of disease, we also have to look at the case rate. And so that's what we show on the right-hand side, the diagram that's in red. So the darker the color, the higher the case rate. And so what we're seeing is segments of the northern part and the southern part of our city continue to be impacted. So outreach efforts across the city have to continue to make sure people are informed about the state of COVID-19 in our jurisdiction, as well as remind them of the mitigation measures that are needed to protect themselves and their loved ones. Of concern, primarily, really, as we look at the northern part of the city, is, as we know, there's high poverty. The high poverty areas seem to be the most impacted in the northern part of the city. We also know that individuals in those communities also are more likely to have underlying medical conditions that place them at higher risk for severe complications related to SARS-CoV-2 infection. And so we use this data to also drive programming and implementation of different activities related to vaccinations and other COVID-19 response efforts. Also look at the case density, and this gives us an idea of where we're seeing hotspots within the city of St. Louis. So the it just states here, you see the warmer colors indicate more higher level of transmission, and the cooler colors show a lower transmission. So we have a diagram on the left that looks at the case density over the last month, and then we also look at over the past 2 weeks. So overall, when you compare the two diagrams, there has been some improvement over the last 2 weeks. However, the takeaway that when I look at this, the thing that I take away is that there's still ongoing spread across all segments of the city of St. Louis. So every ward, every neighborhood continues to be impacted by SARS-CoV-2. We do have some hot spots that we've identified in the southern part of the city. So in Ward 20, it's kind of the junction of Ward 25 and it's like Ward 25 and 9 is 9 circles around Ward 20. So there's one hotspot that has remained consistent in the southern part of the city. And so our communicable disease teams investigate those cases and work with those community members to make sure they're implementing the proper mitigation measures. But again, this also is critical data that is used to help inform decision-making as well as implementation of certain COVID-19 response activities. As I mentioned before, so we'll look at the demographics of the cases that are being reported in the city. When we break this down by race, we see that African Americans, which are indicated by the purple portion of the bar, has been disproportionately infected when we going back to April of this year through September, accounting for almost 70% every month. Had the highest, they accounted for the highest proportion of cases in May. They accounted for roughly 80% of newly reported COVID-19 cases. So this is really a challenge for us. But although African Americans are disproportionately affected, we also know that other communities are also, or races are also, racial groups are impacted as well. And so we continue to do our outreach, but we are really focusing on those areas that need it the most. And as we see here, when we look at the previous maps with those areas in North City that have the highest burden of disease, I know that a lot of those are heavily populated by African Americans. So working with organizations who have established trust within those neighborhoods is really critical. And so we'll continue to do that work. I will also continue to work with other partners such as the school systems in the city of St. Louis, as well as other forward-facing community-based organizations that again have established trust within these organizations, within this community. Is going to be critical as we move forward. Overall, females have consistently accounted for over 50% of COVID-19 cases since the beginning of the pandemic, and we attribute a lot of that to healthcare seeking behavior. That females are more likely to seek healthcare services, and so that's if they're seeking healthcare services and they're getting tested, then they're more likely to account for a higher proportion of the cases. So the health department is concerned about the impact that the SARS-CoV-2 is having on males as well. And so we'll be doing more outreach specific to males across across the city of St. Louis to really remove stigma around not only testing COVID-19 testing, but also removing stigma around preventive health. There have been barriers and issues that have prevented individuals, especially males, from seeking healthcare, and so that's a major challenge that we'll be working to identify solutions for and implement solutions for over the upcoming months and years. We also break down the information by age. So we look at the beginning of the pandemic, we know that it was predominantly the elderly population, older individuals, and those who had underlying medical conditions who were impacted by COVID-19. But as we've kind of moved through the pandemic, we've seen younger segments of our population get infected with SARS-CoV-2 and develop COVID-19 disease. And of concern right now is that individuals younger than the age of 20, so those who are 19 years of age and younger, are accounting for over 30% of the COVID-19 cases that are being reported in the city of St. Louis. And within that segment of our population, we're really concerned about individuals who are aged 10 years and younger, because they account for the largest proportional increase of COVID-19 cases. We know, and this is a major concern for us, because we do know that that age group is not eligible to receive a COVID-19 vaccine. And so we continue to urge our academic institutions and also parents and guardians to implement the measures that are needed to slow the spread among this population. Again, because they're not eligible to receive a COVID-19 vaccine, wearing a face covering, social distancing, practicing good hygiene are really the key things that have to be done to really protect their health. And so we'll continue to work with the academic institutions, particularly the primary and secondary schools, and other organizations to reach parents and adults who have school-age youth. When we look at school-age youth in the city, so this is a cumulative report. So we look at the number of cases that have been reported amongst individuals who are aged 5 to 7 years. And so since the beginning of the pandemic, a little over 2,000 cases have been reported among school-age youth, which is, although it's a high numbers, it's much better than some of the surrounding areas are reporting. And so a lot of that is due to the work that the academic institutions, predominantly the primary and secondary academic institutions, conducted over the last school year, and that they're also conducting this year. We worked with them last year to establish infection control protocols for every school. We revisited those protocols prior to the start of this school year. We also worked with established a work group, or convened a work group that consisted of representatives from each of the school systems, SLPS, charter schools, archdiocesan schools, and independent schools to inform the decision-making that went into that, the development of that document or updating of that document. So all of the school systems agreed to the measures that were included in that document, and they also took time to review and update their infection control plans to make sure they were compliant with the City of St. Louis requirements as well as those outlined by the CDC. We also look at the reproductive number, which kind of gives us an overall view of transmission. So anything greater than 1 is an indication that's spreading exponentially. Anything less than 1 means that its transmission is slowing. And anything equal to 1 is really indication that we've plateaued. And what we're seeing right now, this is how it will look on the graph. So greater than 1, you see an increase in cases. When it's equal to 1, it's a plateau. And then when it's less than 1, you see essentially a reduction in COVID-19 cases, indicating lower transmission. And so we break this down by age group as well. And so what we are seeing is that roughly every age group has reproductive number really close to 1, meaning that we've really plateaued. As I mentioned early on in the presentation, when we've plateaued at such a high level, that really puts us in a very vulnerable position, because in the event that we were to have a surge with the as we plateaued at this current level, that could really easily overwhelm our hospital systems and our public health systems. So our goals at this point in time is really to get the reproductive number as low as possible. The best way to do that is by encouraging individuals to implement the mitigation measures that we've talked about, as well as get vaccinated. Also break it down by race as well. And so similar to the last diagram, so right now, as of 9/11, the reproductive number is really close to 1. So we really plateaued again, which is it's good that we aren't seeing an increase, but it is concerning that we're plateauing at such a high level. For vaccination rates in the City of St. Louis, so as of 9/10, we had 54%, over 54% of the eligible population, meaning those who are 12 years of age and older, have initiated the vaccination process. And we've had 46.8% of individuals complete the vaccination process who are eligible. And this the diagram on the left really shows us the number of doses administered to each racial group. As we've seen, the Asian population has accounted for a lower number of doses that have been given over time. However, we also know that Asians account for a smaller percentage of our population in the City of St. Louis. Then you have the African-American population, is indicated by the purple diagram, the purple line, and then the Caucasian population represented by the gold yellow line. Of concern, though, is that when we look at the the graph on the right-hand side is the vaccination rate per 100,000. So this really gives us a better indication of vaccine uptake amongst a particular population. And so what we've seen over time is that African Americans have continued to lag behind vaccine uptake. And we know that this is a vaccine hesitancy or low confidence in the vaccine products is a very complex issue that we're trying to address by working more closely with them and engaging them in a way that's culturally and linguistically appropriate. And we also have this diagram which shows us where vaccine uptake is in the City of St. Louis, so how the level of vaccine uptake across the different zip codes. So on the left-hand side, you see vaccination initiation. So the lighter colored areas indicate a lower percentage of vaccine uptake. And so similar to what we've seen in the other graph, so in the northern part of the city is where we have our lowest vaccine uptake, particularly in zip codes 63113, 63106, 63101, and 63103. And so again, this data is used to inform our decision making and where we actually host vaccination clinics. And on the right-hand side, we have a diagram that shows us the completion of vaccination in the City of St. Louis across the various zip codes. Similar to what we saw in the other graph, the other diagram, the lowest vaccine uptake, the lowest vaccine completion rate vaccination, COVID-19 vaccination completion rate is in the northern part of the city as well. So zip code 63115, 113, 106, 103, and 101 are all have some of the lowest vaccination rates. So there's still a lot of work to do. We know that there's, again, complex issues that are resulting in vaccine hesitancy and lower confidence in the COVID-19 vaccines, as well as there's a lot of misinformation that continues to circulate in our community. And so one of the things that we're advising individuals to do, especially when we have our town hall meetings, is really get individuals to understand their sphere of influence. You know, each of us has a group within our circle, whether it's a family or friend, who receive what we say as gospel. And so it's really important to make sure that everyone has accurate information, so that when we are relaying information to the community, when we encounter misinformation, we can stop it versus being silent and perpetuating the misinformation, because we know that misinformation can be the difference between life and death as it relates to COVID-19 and other health-related issues. So I'll stop sharing there, and I'll open up the floor to any questions individuals may have.
That was a lot of information. Thank you so much. We'll open it up to the committee for questions. So Alderwoman Green, would you like to go first?
Yes, thank you. Thank you, Dr. Eccles, for being here today. I have a couple of questions. So one is about efforts to increase testing capacity. One of the things that I've been hearing more frequently from residents is that they're having a hard time getting tested in a quick manner. I think in this area, they've been relying a lot on our urgent care systems, and it's gotten to a point where, people have to get on the wait list by 6 a.m. in the morning. And if they're not on it within, by 6:15, all this, slots for the day seem to be filled up, and then they have to start it over the process over the next day. So just curious about efforts to expand that testing capacity, maybe in areas that are seeing kind of surges in testing demand.
Absolutely. So the Missouri Department of Health and Senior Services has issued additional support, provided additional support to the St. Louis region. So they've stood up testing sites across the city of St. Louis. And that information is available on our website. I believe it's also available on our flyers that we circulate for vaccination events. So on the bottom of the flyer, it indicates where those testing locations are and the hours. And so I think, Kim, if you're still on it, if you or Harold can put that information in the chat, that'll be extremely helpful. And so we can send that information out to you all, so people will know that they don't necessarily have to go to an urgent care. There are several no-cost locations where individuals can go to receive a COVID-19 vaccine, including some of the federal qualified health centers as well.
Okay, thank you. Making some notes here, one of the things that I think was really concerning to me about this presentation is seeing that our positivity rate right now is higher than the average across the pandemic. Yet we don't have a lot of those same restrictions in place that we did earlier in the pandemic. And I'm wondering if you could sort of speak to that, and if we're plateauing at this high rate that we're at right now, what is the plan to try to decrease that in advance of a anticipated fall surge?
Yeah, that's a really excellent question. And so we are, as you mentioned, as I mentioned, we've plateaued at a higher level than we want to be. And so mitigation measures are really important. But I think, when we think about how the vaccines were marketed early on, I don't think they were necessarily marketed accurately. So people had a sense of, hey, I got the vaccine, now I have a silver bullet. And the vaccines are not a silver bullet. The vaccines help preserve life. So in the event that you're exposed to SARS-CoV-2, the likelihood that you will have severe complications or die from your infection is reduced, significantly reduced. However, the one thing that wasn't really discussed early on with the vaccines was the prevention. So prevention for other illnesses. So individuals who may have had, if you have heart disease, it hasn't been properly monitored. If you have diabetes, you haven't been properly monitored. You have other immunocompromising conditions that haven't been well monitored. You're still more vulnerable to having severe complications. And so one of the things that we're really enforcing as we talk to community members is, or emphasizing as we talk to community members, is the importance of preventive health. So making sure you go to your annual doctor's visits, you're following up with the provider if you have any issues, you're following medical instructions to make sure you're able to maintain the best health possible. And along those lines as well as making sure that you are implementing proper dietary lifestyle modifications. So eating a healthy, a well-balanced meal, making sure you're walking or exercising regularly. Those key things help establish our baseline for health. And so even if you're vaccinated, your baseline is really poor. The vaccine may provide some protection, but it's not a cure-all and it's not a silver bullet. And so we really have to focus on those other preventive health measures as well, so that individuals can truly achieve optimal health and have the best outcomes possible. But as we approach the fall and winter months, we know that we really have to follow the science here. So we know that even for those individuals who aren't vaccinated, wearing a face covering, for those who are and aren't vaccinated, wearing a face covering is still really important, because based on the most recent evidence that's been released by the CDC and NIH, we know that individuals who are fully vaccinated can still get infected and they can still spread the virus to others. And so it's really important for individuals to wear a face covering, social distance as best they can, especially with individuals who are outside of their household, and practice good hand hygiene. As we move towards the holiday season, we know that's a time when families typically gather. So we really need for families to really rethink how they gather, even during this time. We know people want to gather, they want to socialize, they want to be around people who are familiar and who they're comfortable with. But we really have to make sure that they are implementing measures, implementing plans that will protect the health of themselves and their families. In the city of St. Louis, we've seen very dire situations where family members have attended events knowing they were positive and then infected other people within their family network. One case, there was a 5-month-old that was infected, right? And so that's something that we really have to be careful about. And so over the upcoming weeks and months, the health department will continue to make sure we're getting information out to as many people as possible, reminding them of the importance of implementing these mitigation measures to protect their health, the health of their families, and the community at large.
So during the holiday season last year, I think we had capacity restrictions or advisements of, 10 people or less kind of in your pod. Do we anticipate, we still had a surge even with that messaging out there, but right now we have none of that kind of capacity restriction messaging out there. Do we anticipate, restrictions like that needing to go back in place as we approach the holiday season in particular?
So we're really doing our very best to prevent having to do that, because we also know that there are economic challenges that come along with that. So economic consequences. So, that some of our most vulnerable populations were those who are in the service industry. So you take them out of employment, and then if there's no financial support available for them, how do we help them survive over the course of the remaining portion of the pandemic? So we really have to focus on making sure people are implementing the mitigation measures, but also encouraging individuals, as many people as possible, if they're eligible to receive a COVID-19 vaccine, we really need them to get vaccinated. That's what really will help us keep establishments open, keep people employed, and reduce the likelihood that individuals will have severe complications if they are infected.
Okay. One final question. I think, as you know, I've been one of the 1/3 of people who have contracted this that ended up with long COVID. And it seems like this is, there is becoming greater awareness on it, but we're also, I think, seeing a lot more people that are having long-term health consequences from COVID. I'm wondering what planning the health department is starting to do around support for folks that, are not able to, get right back into work, get back right into their regular lives because they're, they're dealing sometimes for months on end with the implications of having COVID.
Right, and that's, we're still learning a lot about COVID-19 disease. It impacts everyone a little differently. And so as we learn more information, we'll work with our key stakeholders, which includes the Board of Aldermen and the Mayor's office, to see what provisions can be made and the City Council's office to make sure, see what provisions can be made for those individuals.
Okay, thank you. That's all of my questions for now.
But one quick thing, so we also encourage all HR departments for business establishments to be more flexible in how they manage individuals who are impacted by COVID-19 disease. So we've seen different policies being implemented across different city businesses. And so our hope is that the HR departments in those organizations will continue to be flexible over the upcoming months and even years as we kind of navigate our way through this pandemic.
Thank you.
Alderman Gunther?
Yes, thank you. I just have one really quick question. Dr. Echols, can you give us any sort of update? I know that some of the funding that we recently passed was for a mobile vaccination unit. Can you give us kind of a timeline of when that might be out and rolling so that we can get them into that southeast part of the city that has a giant red dot on it? That'd be my only question. Thank you.
So that's another great question. So we have worked with the Supply Commissioner's office, and so the vehicle should be being built at this point in time. And so we're hoping, I believe October, November was the turnaround time for that. But in the meantime, we continue to use our the health department's trailer to go out to host vaccination clinics at various locations in the city. And the other thing, so Alderman Gunn, thank you for bringing that up. So if if any of you want to have a COVID-19 vaccination clinic at a particular location in your ward, please let us know. Reach out to the health department. We would love to work with you all. And I think, as we move through the course of the pandemic, we really need to work more closely with the Board of Aldermen to make sure that we are, because there may be some things that we aren't privy to as a health department. And so you all are on the front lines in your communities. And so there's an opportunity for the health department to better support your community members. We would love to be able to do so.
Alderman Middlebrook?
Thank you. I have no questions.
Alderwoman Rice?
Thank you. Thank you, Dr. Echols, for the presentation. I very much appreciate that. And if these are sort of revolving slides that the health department is putting together, is there a place online that we can find kind of these updated numbers? Are you just creating these as we request hearings on them?
No, so we do this every week. So
Okay.
we want to make sure we're looking at the most current data. I also want to make sure that we're making informed decisions using good, accurate data.
Sure. Are those so then are these types of slides, like these maps and graphs, available are they uploaded to the website every week, or are they just internal?
So they're not uploaded to the weekend. What we uploaded to the website. What we can do is send them to the Board of Aldermen's liaison, I believe it's Kevin Bailey, and have him forward them to you. Or if it's easier, just have one copy sent to Alderwoman Ingrassia for the Health and Human Services Committee, in addition to having it provided by the liaison for the Board of Aldermen in the Mayor's office. That'll be, you all can let us know.
Sure, I do think it's helpful. We do receive the pandemic task force information every day, and so having this type of like weekly update for what is specific to the city, I think it is helpful for us to watch our zip codes, our neighborhoods, our wards move on there. Great. The question about the mobile clinics and events, is there someone in particular at the health department that we should contact if there are events that we would like to have vaccination outreach at?
Yes, so our health service manager too, Mr. Justin Hauser.
Okay.
And Harold or Kim, you can put Justin's email address in the chat. That'll be helpful. You reach out to him, and then he'll let you know what the availability is, and then we'll work with you to schedule an event. One important thing that we found to be extremely helpful is if the organization that we're working with, that they can do some canvassing around the area where the vaccination event is being held, so that the community members are aware that we'll be there. That works out extremely well. And so we can make arrangements for that to happen for any upcoming events. That will be well appreciated.
Great. Mr. Hauser's done a fantastic job. So thank you for that. Okay. And then, so I guess I similar to Alderwoman Green's questions about restrictions. I know that we don't want to go back to the situation where we're restricting indoor gathering, but I'm watching, several large events, scheduled, like we get invitations to large events that are happening here in the city and that are indoors, that are meetings or otherwise. And I'm wondering, when these are getting scheduled, do those folks are they talking to the health department? Are they, how is masking being enforced? How is distancing being enforced when these are sort of all day indoor events?
Yeah, so that's so at this point, so early on in the pandemic, all of those plans were being submitted to myself, the special events office, and we'll review them. And they had to have an infection control component to their plan. And so there are templates. Most organizations and businesses have the templates that were created, but when we rescinded the orders, so they were no longer required to submit those to the health departments, but we do continue to work with certain organizations who want to make sure that they're doing what's in the best interest of the health of their patrons and citizens. And so on occasion, we'll review updated plans, but they aren't doing that necessarily. Not every organization isn't doing that consistently at this point.
Okay. And then as far as testing goes, the flyers that you all have been putting out with the vaccination opportunities and the testing opportunities, I think those are coming out weekly. Those are great flyers. I think the more we can link folks to those so that they can expect when those are coming out, that's incredibly helpful. I am seeing lots of folks talking about at-home testing, and how does that play into, folks that are getting hold of tests like from Walgreens or something like that, or even the Missouri Department of Health and Senior Services is offering at-home testing. Some of those I think are ones that you wouldn't necessarily ever have to report. I think the Health and Human Services, you send those in and then those come back to you. How do you have any thoughts on that, or best guidance or practices around those?
And so my thoughts on at-home testing is that there are some significant limitations. So if someone tests positive and is using an at-home test and it's not verified using a PCR test at a medical provider's office, then the health department wouldn't receive that information. So that really limits our ability to actually respond and to conduct the case investigations that are needed to protect the community. And so we urge individuals, we know there are lots of different not vaccination products. There are a lot of testing options at this point in time, but we urge individuals, if you know you've been exposed, if you have symptoms, please get a PCR test. And the PCR tests are available at medical providers' offices and the FQHCs, as well as the locations that have been established by the state. That way they know they have accurate information. And then the health department also becomes informed so that we can do the work that we are responsible for doing to protect the health of the community. Because to have individuals in our community who are tested and they are positive, but we don't know about them, that can really create a larger issue that could have been prevented. And so we urge them to use the resources that have been made available by the state and the health department.
Okay. Thank you. I feel like that's really helpful information to get out to the public. And then the last question, vaccine incentives. So that was another item that we passed in Board Bill 2. And so I was wondering if you could update us on how that's going. Well, so I guess the new efforts to roll out incentives, but then if things like the Cardinals tickets, et cetera, are you finding that those are helpful or maybe have no effect on folks getting vaccinated?
So we knew it would be helpful for a particular segment of our population, but the and so we've seen an uptick in individuals wanting to get vaccinated because we are offering, the $100 gift cards now, as well as the Cardinals tickets and other items that we provide. But there's still a large segment of our population that has a deeper level of distrust, and it's not something that will be addressed by an incentive. It really requires consistent and genuine engagement over a long period of time, because what we've seen is the same individuals who were impacted by the shutdown of hospital number 1, hospital number 2, urgent care. Those individuals we still remember what that felt like, to have resources stripped from their communities and then to be left hopeless, right? And so as I spoke with the senior group yesterday, a retirement group, and that's what they remember. They lived through that experience. And so even though now we have these life-preserving, life-saving resources, for us to go in and say, hey, we know that was damage occurred, that happened back then, take the vaccine. It doesn't work that way. It really doesn't work that way. You really have to do a better job as a government agency, not just as a health department, but across all aspects of city government. We have to really engage the community in a way that's really meaningful, in a way that is consistent, in a way that really speaks to their needs. But before we do that, or at the initiation of that process, the first thing we have to do is acknowledge that our organization, whether we were here or not, our organization caused harm, our organization caused damage to your community. We weren't here, but we're sorry. And that's what our community needs to hear. We approach them for a lot of stuff, whether it's completing surveys or doing X, Y, and Z, and now it's COVID-19 vaccine. But when did we stop and say, hey, we're sorry? Right?
Mm-hmm. Absolutely. Yeah, thank you for that. That is deeply important. I guess shifting just one more topic. I'm sorry, I've been a little bit all over the board here. Folks are getting information about booster shots. And I know that particularly immune compromised folks have been reached out to by their doctor's offices if they're eligible for those types of things. Could you speak a little bit to if, I guess it's really hard to track down the right news information about, what vaccines are being offered as booster shots. There's even been conversation about whether you should mix and match your vaccine. So if you got one time, get another one the other time, particularly if it was like Johnson & Johnson versus Moderna or Pfizer. So if you could just speak a little bit to that, I think this is a helpful forum to maybe try to clear some of that up.
Absolutely. So Tricia, I think your second question first. So mixing and matching is a no-go. That's something that should not be done at this point in time. It hasn't been well studied, and so we don't know if there are going to be long-term consequences or there's going to be any type of cross-reaction that may potentially occur. And so we always encourage individuals to receive the same vaccine product for their booster dose that they received when they became fully vaccinated. And so if you got Moderna or Pfizer, if you got Moderna, get Moderna. If you got Pfizer, get Pfizer. And get Johnson & Johnson, get Johnson & Johnson. As it relates to the information about booster doses right now, the FDA is still meeting, and I believe the Advisory Committee on Immunization Practices is scheduled to meet this week to determine when the booster doses will be officially approved for the general population. Based on the information that we received so far, it's likely that Pfizer will be approved first as a booster dose for individuals who are fully vaccinated. So, the individuals who received Pfizer for their first and second doses will be eligible to receive their booster dose 8 months after they receive their second dose. The information for Moderna and Johnson & Johnson are lagging behind. So it is likely that those vaccine products will receive approval at a later date. But right now it's looking like Pfizer the Pfizer COVID-19 vaccine will be approved for a booster dose either this week or maybe even next week.
Okay. All right. I think that's good information. And always encouraging folks to go and get their flu shots as well. That this is, I guess, thinking about boosters, it's in the same vein that you go and you get a flu shot every year because there's different immunities that are built up by the different strains that are used in each. And so I guess that speaks back to the relationship that you were talking about as well, that as the department fosters that relationship of caring, that we then continue to encourage people to get those next shots as needed as well. So thank you so much. I think that's all my questions.
One thing you brought up, Alderwoman Rice, is connection to the community. And so as we look at, so one of the things that the health department is really adamant about is making sure we look at how the system operates, because we know that the way the system is set up, that certain populations become disadvantaged, right, or further disadvantaged. So we would love to have a really in-depth dialogue with the Health and Human Services Committee about how we can move forward to create system-level change that our communities need, because this extends far beyond what we're seeing with COVID-19. There are other issues that were pre-existing, whether it's gun violence, if it's hypertension, diabetes, other health issues that we really are responsible for addressing, but we can't do it as an agency alone. We really need key stakeholders, which includes the Board of Aldermen and the Health and Human Services Committee, to help us champion this very critical work.
Absolutely. Thank you.
Alderman Todd.
I don't have any questions. Thank you.
Alderman Vaccaro, do you have any questions?
Actually, just one. I mean, most of them were answered, you know, I guess on the vaccine rollout, that was the incentive thing that was kind of answered. But just more on the flu shot. Normally they have an idea of what flu's coming and what to put in the flu shot. And I do get it every year. In fact, I'll probably get it pretty shortly. But what did they determine is in this year's flu shot? And is any of the COVID protection also in this year's flu shot?
So for your second question, there is no COVID protection in the flu shot. So there's different viruses, but it's important that you get both vaccines. I'll say that. I don't know what the composition is for this year's flu vaccine offhand. I know that there will be the trivalent vaccine, which has 3 strains of the flu virus, and the quadrivalent, which is typically recommended for those who have underlying medical conditions and those who are older and who may be more susceptible to severe complications if they are infected with the flu virus. So, but we are recommending that individuals 6 months of age and older who don't have any contraindications to receiving a flu vaccine, that they get both the flu vaccine and the COVID-19 vaccine.
Okay, thank you. Well, I get the high dose one because I'm old, so I plan on getting it. I just curious. Thank you, Madam Chair.
Sure thing. Just a couple of quick follow-ups. I think one of the things that Alderwoman Rice brought up and you discussed that's incredibly important is really getting through to this population of folks who is really hesitant for good reasons and not getting vaccinated. Is anyone tracking, as you mentioned, multiple touches on those folks is incredibly important. Is anyone tracking meeting with individuals or maybe you go back to the same nursing home you were just at 2 more times? I'm just trying to figure out if we know that we're engaging in a meaningful way. And also I'm interested in knowing what your thoughts on how best the aldermen can support those efforts.
Great. So we know that was a project that was being implemented by the regional response team, and it's where they created this network of say public health champions, but individuals who could really have discussions about COVID-19. And the return on that, I think I have to follow up with them to see how they followed up with individuals who had participated in those focus groups. I know some of them were virtual, so I'm not sure if they were able to capture all the demographic information that we typically collect. Right now, when we go out, to speak at different different groups, we have the organizations bring together the group, and then if we have resources, we'll capture individuals' names and some of their demographic information, particularly if they're receiving resources from the health department. So that's where we're tracking it now. But other than that, I think that's the area where we can make some improvements to make sure we're reaching as many people as possible, but also seeing if we're touching some folks multiple times and there's still hesitancy or lower confidence among that group.
Okay, and is there anything specifically that you can think of that aldermen can do to support that effort?
Absolutely. So I know that you hold your award meetings. So if you want a representative from the health department to be present during your award meeting, we'd be more than happy to do that. If there are resources such as the flyers that we put out each week, we typically send those out through Nextdoor app, but we can be present to discuss the upcoming vaccination events. Just let us know. And then I think the other thing is within your own networks, if you can share the information that the health department is providing. So, for example, the communication survey, you all can send out that information, QR code, or even the survey for them to a link to the survey for them so they can complete it. That'll be extremely helpful for us. And I think the other thing that will be extremely helpful is if the Board of Aldermen has a some sort of marketing initiative related to COVID-19, because I think they hear a lot from the health department, but it would be great for them to hear from the Board of Aldermen, like what your thoughts are. There's some positive messaging that can not only be shared amongst your constituents, but if there's one standard messaging that all Board of Aldermen members could share out, that would be extremely helpful. That way it's consistent messaging, not only from the health department, but from the governing body of the city of St. Louis.
I really like that idea. Is there someone in your department that I could connect with to work on that?
Yeah, so we have a communications committee with the Board of Health and Hospitals, and they're amazing to work with. So that'll be Harold Bailey, Kimberly Vandenberg, Lisa Richter. I believe Serena Muhammad is on that as well. So they're extremely talented and great to work with. So I think that will be a great source. And then also we're working closely with STL TV, who's hosting us today. Thank you, STL TV, for your support. But they have subject matter experts that can also help tailor the messaging, and also record some videos if you all would like to record videos to share with your constituents as well.
Okay, I'll definitely reach out to the communications committee. Thanks so much for that. And I think these are probably kind of loaded questions, so answer as you think makes the most sense. But I'm incredibly concerned about schools. And I think that, I mean, I have 2 school-age children. It was very difficult for them to be at home for as long as they were learning, but I'm also concerned because there are so many cases of younger kids. Is there at some point, and same for capacity restrictions, it's not something that I love the idea of thinking about, but is there something that would trigger you being as alarmed as you were last year when we did have to see some level of shutting things down?
And so as it relates to schools, our biggest concern with schools is what's happening, not within the school, but what's happening outside the school. So over the course of the school year last year, the issue wasn't, the primary issue was the exposures occurring in the community. So families were having gatherings, they were participating in events where the children were exposed. Then those children, they come to school, then they find out, hey, they're positive. Then we have to go down the road of identifying who's close contact and then excluding them from school for their quarantine period. And so really working with parents. So if the parents can do a good job of protecting the children outside of the school, we can keep our kids in school. The schools we work with them really closely. We follow up with them in some cases every week to see what's happening. But the school administrators don't have any control over what happens in the community at large. And so it's really important, not only, but they must continue to do what they're doing as well. So making sure that students are wearing face coverings when they're in the classroom setting, that they're implementing good hygiene measures as well. But also working more closely, as I mentioned earlier during the presentation, working really closely with the parents and the guardians to make sure that they're doing their very best to protect the health of the child.
Okay, any other takes on, I think especially restaurants, bars, places where people are taking their masks off?
So we still follow up on some of the complaints that we receive in the city of St. Louis. Recently we haven't closed down any bars due to violations. So we really want to work closely with them. We want to provide education. And that's what we've done over the course of the pandemic. As more establishments have their staff vaccinated, so we have worked with them to also host vaccination clinics as well. And so we want to make sure that we're not penalizing them for noncompliance, but really working to see what the root cause of the noncompliance is. And so sometimes it's just misinformation circulating within the organization. So we take time to address that. We also, again, sometimes they may not have had an opportunity or been aware of an opportunity to get vaccinated. So if they want the health department to host the vaccination clinic for their staff, sometimes we'll actually go out and do that. And we've done that on a couple of occasions.
Okay, and quickly related to that, I've had a few businesses reach out to me. It seems like overwhelmingly customers and patrons of businesses are being supportive, but there are cases where people have become verbally or physically aggressive with business owners and staff. Are we offering any sort of support? I mean, I know it's not realistic to call the police every time something like that happens. Do you have any advice or thoughts on how best to support small businesses, especially who are having to deal with that?
As this came up quite a bit earlier during the pandemic, and so our advice to the businesses was, because one, that they weren't sure if they could exclude people. It's like, yeah, as the business owner, you have the right to exclude people if they aren't complying with your rules and regulations. And so in the event that they need to call the police or law enforcement, they have the right to do so. But the most important thing that we found to be beneficial with businesses is that they can provide information to their patrons, say, hey, this is ahead of time. Hey, this is the standard that we're implementing. This is what we're expecting of you as a patron of ours when you come into our establishment. And that's worked really well across the board, from the ZMD institutions to bars, restaurants. It's worked real well. But every business also has different capacity, right? So every business may not have a listserv or patrons or have a website even, right? So, but make sure there's a way to communicate expectations and their rules and restrictions within their business setting is really important. They can do that ahead of time to make sure that their patrons are aware.
Okay, just so you know too, and I guess probably the communications committee is a good place for me to share this information. I'm working with a group of businesses. I think there's about 50 of them right now that are interested in marketing together a vaccine requirement for their customers to be indoors. And so if that's something that the health department would be interested in helping work on, I think that would be valuable as well.
Absolutely, we'd love to work with them. We've aimed to be a partner for the business community over the course of the pandemic and beyond. And so there's good examples that we can provide for businesses that have adopted similar practices, not only in the St. Louis area, but across the nation. So we'll be more than happy to work with them.
Great, thanks. And last question, thanks for spending so much time with us. Are there any of the variants of concern that seem to be creeping up as issues in the not so distant future for the virus?
Yeah, so the latest variant is the new variant. We don't know a lot of information about it yet, so it's being studied. But in the health department, so we haven't really focused on a particular variant, and this is the reason why. So as long as there's ongoing transmission in our community, the likelihood that new variants will develop is likely, right? And so if our focus is stopping the spread of the virus, we stop it at the root. So that's why wearing a face covering, social distancing, those are really key measures that we need to really focus on, because what happens is we focus on one variant and then another variant replaces it. So we become a variant chasers, right? And so we will have to focus on the root issue and going back to the fundamentals, going back to the basics. We know how SARS-CoV-2 spreads. So making sure we're implementing those mitigation measures that have shown to be effective. If we look at the number of flu cases over the last year, I believe there were less than 30 cases of flu during the last flu season. And a lot of that was due to the mitigation measures, but we know how SARS-CoV-2 spreads. So focusing on that and implementing the mitigation measures that have proven to be effective is really what we need to do.
Excellent. Thank you so much for all of your time today and for bringing along some of the members of the board and your staff. We value the work you're doing, and I know it can't be easy having to be this busy and committed for as long as you have.
My pleasure. I see Alderwoman Rice has her hand up.
Oh, thank you. Go ahead, Alderwoman.
Thanks. Sorry, just I have a constituent who has raised concerns about exemptions to the mask mandate, and this is something complicated to kind of work through here, but it specifically at public institutions. So at the library, for example. So there are limited exceptions drawn out within your health order. And it is my understanding that like a private business could choose to be more restrictive than the health order, that the health order is at base, not the limit. So if someone could say, you know, I want masks for everyone, regardless of what the health order says. I'm curious about how a public institution like the library should be working through those exemptions for patrons who are coming in to use that city service. Do you have any thoughts on that?
Yeah, so for the library, so because it is deemed to be a public space, they have to comply with the health order. And so what we can do is reach out to the library's administration to see what challenges they're having, and then if there's ways that we can provide additional support to alleviate some of the challenges, we would love to do so.
Okay, great. And I can follow up with you afterwards more specifically about that too. Thank you.
All right, you're off the hook, Dr. Eccles. Thanks again.
My pleasure. Thank you all for having us, and thanks for being great partners. We appreciate you.
Absolutely. All right, I think we need to excuse Alderwoman Martin from this meeting for necessary absence. Does anybody have any announcements? I will entertain a motion to adjourn.
So moved.
Second.
All right, everybody, thanks so much.